patients might have questions about transferring embryos that have been frozen, right? Like why would I want my embryo to be frozen? That sounds scary. The techniques that we're using to freeze embryos actually work very, very well, and we really do not lose embryos to freezing and thawing. It's about 1% or fewer of embryos get lost to that process. And so the benefit that you get from freezing an embryo rather than transferring it fresh is that actually frozen embryo transfers work better. You have a higher chance of success and even some benefits down the road during the pregnancy towards slightly healthier pregnancies when you do frozen embryo transfers rather than fresh. So when we talk about a fresh embryo transfer, we're talking about doing a whole IVF cycle where we use medications to stimulate the patient's ovaries to grow multiple eggs, take multiple eggs out of the ovaries, and then make embryos and transfer an embryo back into the uterus, in that same cycle. It's all like this in the same few weeks span. The issue is that when we've used medications to stimulate your ovaries, your hormone levels are completely different than what they would normally be in a natural menstrual cycle, which is what the human body is created to, make a baby in. And so if we can separate the two parts of this process into one where we focus on only how are we stimulating the ovaries and how are we making the best embryos without worrying about what those hormone levels are going to do to the uterus, that helps us make better embryos. Because in the old days, they used to have to cancel IVF cycles that even though the embryos were going to be fine, the uterus was going to be affected and they weren't going to have a good transfer. We don't have to worry about that anymore, that we have frozen embryo transfers that work so well. Now we can decouple the two things, make good embryos, let your body recover, and it's really only for about 2 weeks. But at 2 weeks after you have your normal period after your IVF cycle, everything resets and you have all the normal hormone levels that you're normally going to have in a normal cycle, which is how you're supposed to get pregnant. And so we have better implantation rates, better success rates. Actually, there's some long-term implications where actually the pregnancy itself can be a little better with slightly higher birth weights and also fewer complications of pregnancy. And then also the frozen embryo transfer gives us the time that we need to do the pre-transfer genetic testing that we've been talking about.